Today we'll be learning the IV cannulation, peripheral venous cannulation. What is our plan today? To demonstrate how to get a peripheral IV line, and second part, all of you should be performing that in a mannequin. That's the overall learning objective of today. So when you consider venous cannulation, it can be central vein, it can be peripheral. So this is one of the advances in the clinical medicine, and maybe more than 1 billion cannulation is being done. That's such a common procedure all over the world. This can be done by different methods, maybe ultrasonogram guided, maybe bright light can be used to make the veins more visible. And what we are doing usually is without any of this thing, by practical training itself, all these people and the medical students should learn this basic clinical procedure. And where can you do it? Wherever there is a good peripheral vein visible. It can be in the lower limb, it can be in the upper limb. We'll be talking first, what are the steps? Any procedure, when you are doing on a person, on a patient, these 3 steps are very important. One thing is preparatory phase, then actual procedure, followed by the follow-up of these cases. So what are the things in the preparatory phase? All of us know the importance of taking a consent. So here also that's applicable. You should explain the procedure, what you are going to do. It is irrespective of the patient. It can be a child, young child, very young child, you need to get the consent from the parent. Maybe a little older child, you can explain to him, and his permission is actually needed, verbal and written. Below 12 years also, all the procedures, you need to get the assent from the younger child. That is important. What all things are needed? I am talking now about the preparations. After the consent part, and the needed things are, what are things? At the accessible level, wherever you are going to perform this thing, on an easily accessible level, a tray or a surface, clean surface is to be there, where you need to arrange the gadgets, tools you need. What all things are needed? Very important thing is, you should be safe and the patient should be safe. Those 2 things are very important. Safety part, your own safety. The second thing, when you are doing a procedure, whatever it is, you should ensure that you are not doing any harm to the patient, out of which your infection can be transferred to the patient. So ensure that I am not having any infection which is going to transfer. And the very same thing is the hand washing. So all the steps of hand washing should be doing, and otherwise sometimes scientists can use. Hand washing is the better method. After that, appropriate gloves should be worn. For me it is 6 out, 100% 7 out. You wear the gloves. Then you are going near the patient, you are choosing the vein. Which vein you will be choosing? A superficial vein, a straight. You need to have adequate length for the insertion of the cannula. So it should be a straight and a superficial vein. That depends upon which side you are choosing. Most of the situations in the upper limb, you can choose on the dorsum of the hand, maybe the forearm. So that you choose. And after you choose the vein should be prominent for it to be inserted. There are 4 things, 4 procedures for making the vein prominent. What are they? You know, if you are elevating the vein, it will be empty. If you are a little bit dependent, it will be more prominent. So if the hands or that part a little dependent so that the gravity helps the distension of the vein. Then what? If it is upper limb, you can do the same. So the muscle action again will be helping the vein to be prominent. And what is the other thing? A tourniquet to be applied at least 5 centimeters above. If you are using here, you can apply the tourniquet here, maybe for above. So a tourniquet to be applied. So what is the attribute of the tourniquet you need to consider? It should be blocking the venous thing, flow, but it should not be too tight to block the arteries. So that much tightness is ensured. And one very important thing is, don't be in a hurry. You can apply the tourniquet and allow some more time for this thing to get distended. Because you are not blocking the arteries. So no problem. So you tie the tourniquet and you go for the other procedure, maybe 1 or 2 minutes. By that time it gets distended. And the fourth procedure to make it distended is you can tap. A little bit of tapping on the vein, or this will again lead to a little bit of dilatation. Warm will produce a dilatation. So by all these measures you ensure the veins are dilated. Okay. Then after this, in the preparation I said you need, because after tourniquet only you can go for the preparation. You need different sizes cannulas, the appropriate size cannula is to be chosen for that patient. A pediatric patient, they will be choosing either 22 or 24. 24 is a very small one and 22 is the usual one. Okay, and the range of the cannula starts from 14 to 26. The cannula are color coded, easy to recognize, and is anything less than 18-hour wide bore cannula, they are all used when you need a faster infiltration of fluid. Okay, then smaller cannulas depending upon the other administrations. So larger bore, largest will be allowing somewhere around 250 ml per minute. That much fast you can introduce. So I forgot to tell one thing. Indications for intravenous cannulation. There are two. One thing is to introduce something into the body, other is take the blood. So all these things you can imagine from the blood. What all these you can do? You can do the blood grouping. You can do any of the estimations of the biochemical, cytological, whatever thing, using the blood lab diagnostic. You can introduce a contrast material. Okay, so that will diagnostic and the administration. Not many IV fluids can be administered, blood and products can be administered, nutrient, peripheral, parenteral nutrition, you heard of these things. Apart from the usual fluid, a high energy things also can be introduced, and radiographic contrast material also can be used. So anything to be introduced or a sample to be withdrawn. So in the previous years, the decades, what were we using? The cannulas were not available. Needles and something called butterfly needles, scalpel. That was used for all this purpose. What is the problem? It's a stiff needle. So the patient moves a little bit, that will tear the vein and out. So what is the advantage of this cannula over this thing? So once this is a cannula and a stillet. So once this is inside, this is the part going in. So this can move any direction, there is no chance of injury. So this part is utilized only to introduce. Once it is inside, it is out. So this is the part, it is really moving and there is no chance of the injury. So that is the advantage of this cannula or this thing. So we have covered the indications. Now the arrangements, I said different size cannulas are the appropriate size cannula you choose. And you need a syringe and maybe connector. In a resource poor setting, it may not be comparable to what a developed country are doing. They are doing many of these things, connector will be there, alcohol swab will be there. But in a resource poor setting, everything can be done using whatever is available with us. So what we will be doing is a syringe to flush these cannula. 2 cc's will do, 5 cc's will do, whichever. And you fill the syringe with normal saline. You take it and keep it. Okay, so appropriate size cannula is needed and the syringe with the normal saline is taken, and what is needed? Ensure the cleanness and sterile area. There is something like what you are using is usually alcohol, chlorhexidine, whatever. And you can use it with the cotton wipe only. Alcohol wipes need not be costly. And after the procedure, what is needed? It has to be adhered to. So there are the tapes and the venous, the cannula to be secured. So before that, you need the venous securing things also. So all these things are arranged. Then only you are going to do the procedure. So how are you going to do the procedure? I'll choose this hand. Okay. Okay, we have discussed already how to make the veins prominent, a little bit dependent position, asking to do this. Okay, for a while, then I can apply a tourniquet a little above. It's a primitive method. You can use a gloves or this thing also. There are tourniquets available. So this should be adequate enough to block the veins, not the arteries. So do this thing, wait for a little time so that it will get distended, and hold it like this, and this thing, by tapping, it becomes more prominent. Okay, once it is prominent, then only you clean it. Alcohol, why? You do it cleaning, how you do clean? The circular motion starting from within, go out, you are not going to take inside again. Remove it. So clean that area. Then what is needed is a little bit of stretching is needed. So because you are going to keep the cannula very close, angle will be somewhere around 15-20 degree. So that is the, so your fingers stretching should be a little lower. It should not be like this. Okay, a little lower, and the stretching is needed enough to prevent the vein slipping and the skin. A little bit of stretching. Too much of stretching, it will get blocked. So a little bit stretching, and then you ensure the straight, and you decide where is it. So there is no branching. This part is to be chosen. So I am going to do. Before I am going to demonstrate on the mannequin, I just show you this. Imagine this is the vein, and over this thing only skin is there, and this is the cannula you are using. I said cannula is coming in the cover. You remove the cover. This is the cap, and there are, so this is the stellate part, and this is the cannula. This is going to be residing in the vein. This you will be taking out. See, what is the purpose of this thing? This is a cannula. It cannot be introduced because it's not sharp. So you are utilizing the sharp edge to enter through the skin and the upper surface of the vein. Once it is entered, you are going to take it out and advance this outer part. And you are removing it. So how you are going to do it? It is very 15, 20, 30 degree, not more than that. What is the harm in doing it? You are going to puncture the lower. So you need to puncture and enter, and this outer cannula also should be inside. So the tip followed by this one should be enter inside. And after the entry, you are going to take out the cannula and advance the outer. That's what you are going to do. Angle should be somewhere 20, and just see this side. Okay, enter. Okay, once it is entered, you ensure that outer part also is entered. Okay, there is a problem sometimes. This tip only entered. So that, how can you ensure? Once you get the feel that it is entered, a little bit, depending upon the size of the cannula, maybe 1 millimeter, 2 millimeter more, you advance. Okay, after that, you just dip it a little, so that you are not going to hit the other side. So once it enters, it down a little bit. Okay, and then what are you going to do? You are going to take away, withdraw this thing out, and not out, totally out. Withdraw this a little bit, and a little bit withdraw, and you are just advancing this part into the front. So that this is the one remaining. This is just used to entry part. That's what you are going to do. After this thing, you will take away, and just before taking away, you will be pushing, keeping this thing pressed so that blood won't be coming out in gush. You remove the tourniquet and then totally you remove this tillet and you connect with either of the fluid or blood or whatever, or maybe you can take samples, or you can connect the syringe and flush. So whatever you can do, that is the procedure. Of course, after this thing, you are securing the well. That's my provision. When was it done? The time. And after this thing, your waste management also is very important. Whatever thing you have used, this where will you throw this thing? So that is one thing which is very important. At the time of preparation, the sharp should be disposed in the proper manner. And at the end, the waste management also is very important. And after you finish, you wash your hands, apron, everything is removed. And if it is a real patient, you will be thanking the patient. Then only the procedure is complete. Okay? So we'll just see how it can be done only. ഇതാണ് ഞാൻ വെയിൻ യൂസ് ചെയ്യുമെങ്കിൽ മനസ്സിലായോ? അപ്പോൾ ഇവിടെ കുറേ വെയിനുകളുണ്ട്, കുറച്ച് വലിയ വെയിനുണ്ട് കണ്ട. അപ്പോൾ 4 ആമ്പിലാണ് യൂസ് ചെയ്യുക. അപ്പോൾ മേലെ ഒരു ടൂണിക്കറ്റ് ഞാൻ കെട്ടി വലിച്ച് കെട്ടി ഇനഫ് ടു ക്ലോസ് ദി വെയിൻ അല്ലേ മറ്റേ. അപ്പോൾ എടുത്തിട്ട് ഞാൻ വെയിന് നന്നായിട്ട് ശ്രദ്ധിച്ചു. അപ്പോൾ ഡിപ്പെൻഡൻറ്റ് പൊസിഷനിലാണെന്ന് നോക്കി ടച്ച് ചെയ്ത് ശരിയാക്കി. അപ്പോൾ ഓൺലി തിങ് വൺസ് നമ്മൾ സ്റ്റെറിലൈസ് അല്ലെങ്കിൽ ക്ലീൻ ചെയ്തിട്ട് പിന്നെ ടച്ച് ചെയ്യാൻ പാടില്ല. സോ കോമൺ മിസ്റ്റേക്സ് എന്താ? ആഫ്റ്റർ ക്ലീനിങ് യു വിൽ ബി ടച്ചിങ് അഗെയിൻ വിത്ത് യുവർ ഫിംഗേഴ്സ്. അപ്പോൾ ടാപ്പ് ചെയ്യാൻ പാടില്ല. ഷാർപ്പ്നെസ് നോക്കാൻ പാടില്ല. കാനുലേൻ്റെ മനസ്സിലായോ? ദി ടിപ്പ് ഓഫ് ദി കാനുല ഷുഡ് നെവർ ബി ടച്ച്ഡ്. അപ്പോൾ ഇൻഡോനേഷ്യൻ ഇൻഫെക്ഷൻ. സോ ബോത്ത് ദീസ് തിങ്സ്. അപ്പോൾ ഓൾ ദീസ് ടച്ചിങ് ഷുഡ് ബി ഡൺ ബിഫോർ ദ ക്ലീൻ. വൺസ് യു ക്ലീൻ അതിന് ശേഷമാണ് നമ്മൾ ചെയ്യാൻ പോകുന്നത്. അപ്പോൾ ഞാൻ എന്താ പറഞ്ഞാൽ ഒരു ചെറിയൊരു സ്ട്രെച്ചിങ് വേണം, എന്നിട്ടാണ് ഇൻട്രൊഡ്യൂസ് ചെയ്യുന്നത്. ഓക്കെ. അപ്പോൾ ഞാനിപ്പോൾ ആൽക്കഹോൾ വൈപ്പാണ് വരുന്നത്. ഹിയർ ഇൻ സർക്കുലർ മോഷൻ വൈപ്പ് ചെയ്ത് ഇനി ലൈറ്റ് ഒന്ന് മാറിക്കും. ഓക്കെ, ഇങ്ങനെയാണ് നമ്മൾ ഇരിക്കുന്നത്. എന്നിട്ട് എന്താ വരുന്നത്? വൺസ് ഹൗ ക്യാൻ യു നോ വെദർ ഇറ്റ് ഈസ് എൻറ്റേർഡ്? ഒരു ഫീൽ ഉണ്ടാവുന്ന മാത്രമല്ല, യു ക്യാൻ സീ ദ ബ്ലഡ് ഇൻ കമ്മിങ് ഹിയർ അറ്റ് ദി എൻഡ് ഓഫ് ദിസ് തിങ്. ആ സ്റ്റില്ലറ്റിൻ്റെ എൻഡിൽ ഈ ചേംബറിലൊക്കെ ബ്ലഡ് ഇങ്ങനെ വരും. അപ്പോൾ അതിൻ്റെ അർത്ഥം എന്താ വെച്ചാൽ ഇറ്റ് ഈസ് എൻറ്റേർഡ്. സോ ദാറ്റ് ഈസ് എ പോയിന്റ് വേർ എ ലിറ്റിൽ ബിറ്റ് ഓഫ് അഡ്വാൻസ് ആൻഡ് ഫോളോഡ് ബൈ അഡ്വാൻസിങ് ഓഫ് ദ കാനുല ഓൺലി. ആ പോയിന്റിലാണ്. അപ്പോൾ എത്തി എന്നുള്ളതായിട്ട് മനസ്സിലാക്കാനില്ല. അപ്പോൾ ആ ഫ്ലാഷ് ബാക്ക് മനസ്സിലായോ? ഓക്കെ. അപ്പോൾ ഇങ്ങോട്ട് ഫ്രീ ഫ്ലൂയിഡായിട്ട് വരണം. മനസ്സിലായോ? കണ്ട സമയം. അപ്പോൾ ഇത് വന്ന് കഴിഞ്ഞിട്ടാകുമ്പോൾ നമ്മൾ എന്ത് ചെയ്യണം? ഇവിടെ പ്രസ് ചെയ്തു. ഐ ഡോണ്ട് വാണ്ട് ദിസ് തിങ് ടു കം ഔട്ട്. മനസ്സിലായോ? അപ്പോൾ ഇവിടെ പ്രസ് ചെയ്യുന്നു. അത് കഴിഞ്ഞിട്ട് ഇത് ശ്രദ്ധിക്കണം, ഇത് റിമൂവ് ചെയ്യുന്നു. ടൂണിക്കേറ്റ് റിമൂവ് ചെയ്യുന്നു. ഇതിപ്പോൾ ഈ കേസിൻ്റെ അകത്ത് ഞാനിപ്പോൾ ക്ലോസ് ചെയ്യുകയാണ് ചെയ്യുന്നത്. മനസ്സിലായോ? അതല്ലെങ്കിൽ എന്ത് ചെയ്യും? ഡിപ്പ് സെറ്റ് കണക്ട് ചെയ്യുന്നു. അതല്ലെങ്കിൽ ബെഡിൻ്റെ വാട്ടർ വർക്കി. അപ്പം അത് ചെയ്യുന്നു. അപ്പോൾ വൺസ് ഇറ്റ് ഈസ് ഓവർ നമ്മൾ ക്ലീൻ ചെയ്ത് അതിന് ശേഷം അഡ്ഹർ ചെയ്യണമല്ലോ. ഞാൻ അടുത്ത് വെച്ചില്ല സാധനം ഉണ്ടല്ലോ, കൊണ്ടുപോയി ആൻഡ് അതർ വൺ ഓവർ പിന്നെ മേലെ 2 പീസും കൂടി വെച്ചാൽ അഡ്ഹർ ചെയ്ത് കഴിഞ്ഞു. അപ്പോൾ ആഫ്റ്റർ ദിസ് തിങ് ഞാൻ പറഞ്ഞതല്ല, യു റിമൂവ് this thing, remove the gloves, clean your hands. Okay, of course at the end, cannulation.